Good evening, friends. I am going to talk about malaria. Malaria is caused by a single-celled parasite called Plasmodium. The parasite is transmitted to humans most commonly through mosquito bites. Malaria transmission cycle. Malaria spreads when a mosquito becomes infected with the disease after biting an infected person, and the infected mosquito then bites a non-infected person. The malaria parasite enters the person's bloodstream and travel to the liver. When the parasites mature, they leave the liver and infect the red blood cells. Uninfected mosquito. A mosquito becomes infected by feeding on a person who has malaria. Transmission of parasite. If this mosquito bites you in the future, it can transmit malaria parasites to you. In the liver, once the parasite enters your body, they travel to your liver, where some types can lie dormant for as long as years. Into the bloodstream. When the parasites mature, they leave the liver and infect your red blood cells. This is when the people typically develop malaria symptoms. On to the next person. If an uninfected mosquito bites you at this point in the cycle, it will become infected with your malarian parasites and can spread them to other people. It bites. Other modes of transmission. Because the parasites that cause malaria affect red blood cells, people can also catch malaria from exposure to infected blood, including from mother to unborn child, through blood transfusion, by sharing needles used to inject drugs. Risk factors. The greatest risk factors for developing malaria is to live in or to visit areas where the disease is common. These include tropical and subtropical regions. Risks of severe diseases. People at increased risk of serious diseases include young children and infants, older adults, travelers coming from areas with no malaria, pregnant women and their unborn children. In many countries with high malaria rates, the problem is worsened by lack of access to preventive measures, medical care and information. Complications. Cerebral malaria. If parasites-filled blood cells block small blood vessels to your brain, swelling of your brain or brain damage may occur. Cerebral malaria may cause seizures or coma. Breathing problem. Accumulated fluid in your lungs can make it difficult to breathe. Organ failure. Malaria can damage kidneys or livers or cause spleen to rupture. Any of these conditions can be life-threatening. Anemia. Malaria may result in not having enough red blood cells for adequate supply of oxygen to body's tissues. Low blood sugar. Severe forms of malaria can cause low blood sugar, as quinine, a common medication used to combat malaria. Very low blood sugar can cause coma or death. Prevention. Cover your skin. Apply insect repellent to your skin. Apply repellent to clothing. Sleep under a net. Thank you.